Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can look at a presentation analysis for obsessive-compulsive disorder. So I've seen an interesting presentation analysis for a case involving OCD and OCPD. So with OCD, obsessive-compulsive disorder, we see obsessions and compulsions, so intrusive thoughts, and then behaviors that, in theory, relieve anxiety. And then with OCPD, that's obsessive-compulsive personality disorder. Now, they're related. Some of the time they're comorbid, but they are distinct disorders. So again, OCD has obsessions and compulsions, and OCPD is a personality disorder. So a presentation analysis is when a clinician, a therapist of some type, wants to complete a report about a particular client experience because it has educational value. So the clinician requests permission from the client, consent, and if consent is granted, they write up the report, and usually it's presented at a training, conference, during a class, sometimes it's published, or something like that, something to that effect. A presentation analysis is also sometimes called a case analysis, a case study, a case report, or a presentation study, but they all really mean the same thing. Information is changed, like names, but the clinical essence remains, in theory at least. One of the challenges with these presentation analyses is that information gets passed from one person to another a few times. You have the client telling the counselor or other type of therapist, so there's room for error there. The counselor writing the report, they can make mistakes there. The report presented to an audience, because it's not always the counselor who presents it to the audience, and sometimes they might forget what they meant by certain things in the report. So we see kind of some problems with data integrity throughout the course of the process, but there's still really interesting learning opportunities. So I'll go ahead and introduce the people in this presentation example. Again, the names are changed. We see the client, I'll call her Brenda, is a female in her early 50s, never married, and no children. At the time the report was made, this was at the end of therapy. She had been seeing the clinician for 4 years. The clinician, who I'll call Susan, is in her early 60s. She's a master's level practitioner with 5 years practicing at this level. So before this, she did casework at the bachelor's level. So we see the report indicates that Brenda is a good historian, absent any trauma, absent any substance use, and is consistently oriented to person, place, and time. So when she presents in the counseling sessions, she's aware of who she is, where she is, and when it is. We see that Brenda initially came into counseling to learn strategies to more effectively deal with her coworkers. She refers to her coworkers as overly emotional and irrational. But she acknowledged early on in therapy that she would have to make some changes because her coworkers would not change. She also wanted some help managing obsessions and compulsions, specifically around counting rituals. Brenda grew up in a middle-class household. Both parents worked. Brenda was the youngest of 3. She had one sister who was 3 years older and a brother who was about 8 years older. The parents hired a babysitter from the neighborhood who would watch Brenda and her siblings on days when they were not in school. Brenda describes her childhood as stressful. Her and her older sister shared a room, and her brother had a room of his own. She has memories of not having a lot of possessions like clothes, books, and toys, and she particularly liked books. Her older brother and sister would sometimes damage her books and toys, but generally they left her clothes alone. She recalls wanting everything to be perfect, not liking things that were damaged, like scratched, or in the case of a book, if a page was damaged or ripped out, she would usually discard the whole book, even if she was not the owner of the book, which got her into trouble a few times in school and, of course, with her siblings. When she was 10 years old, her older brother, who was 18 at the time, was sentenced to significant prison time for serious crimes against property. It's not specified what crimes, but I would guess something like burglary or arson. Again, it's not really clear. He would be released from prison several years later, but due to further criminal acts, he was incarcerated again. Brenda never had any substantive contact with him after that, the second time he was sentenced. After the brother's first incarceration, her sister moved into the brother's room, and Brenda was happy to have the privacy, and she was better able to protect her property because, of course, the brother was gone, and again, the sister wasn't in the same room. She was given permission by her parents to put a locking doorknob on her door, the door to her room. She had a key and her parents had a key. She started locking the door and counting a specified number of times as she turned the lock. In the presentation of this case, it was said to be 10 times. She'd have to do everything 10 times. But of course, some of the details of these cases are changed, so it's hard to know what the exact number was. We see that if she was distracted in the middle of counting, she would lose count and have to restart counting at 1. We also see that she checked and rechecked the light switch in her room to make sure it was fully down when she left the room. She believed if the lights were left on, a fire could break out and her property would be destroyed or at least damaged. When she left school in the morning, she would unplug everything in her room, including clocks, which meant that she'd have to set the time each day again when she came home, the time for a clock. She eventually expanded this behavior to unplugging a lot of different appliances in the house, and this also caused a lot of problems. The parents would come home, and none of the clocks would be correct. Her father eventually bought her a wind-up clock and had to replace all of the clocks in the house with wind-up clocks. With her wind-up clock, she would wind it up every day and check it several times to make sure it was completely wound up. Eventually, Brenda wore out the locking mechanism in her doorknob, so her father just removed the doorknob completely and replaced it with a kitchen cabinet handle. After this, her sister started going to her room and borrowing her toys and books. Brenda reports this caused a lot of anxiety, so eventually she asked to borrow her parents' camera. The idea here was that she wanted to take pictures of all her property so she could prove where everything was if her sister were to touch anything. She also asked her parents if she could get an insurance policy to cover her personal belongings. Remember, this is when she was 10 years old. She believed the photographs would help establish that she owned the property in the first place, and again, it would help resolve disputes with her sister, and even sometimes with her parents. Now, these photographs become a source of anxiety for Brenda as well. She first stored them in a cardboard box, but then she worried about the box being stolen, catching fire, getting wet, so her father bought her a lockbox. Not one that had a key, but one that had a 3-digit combination built into it. So then Brenda worried that somebody would figure out the combination, so she would reset the combination every day. And then she would write the numbers down on a piece of paper, but then tracking all these pieces of paper became a problem itself. So she'd have this little piece of paper in her pocket, would have the combination, she'd come home, change it, have to write the code down on a new piece of paper, and completely destroy the old piece of paper. Then she started writing down the combination on several pieces of paper and hiding them in different places in the house, so she'd always have access to it. But then she started to forget where she was hiding them. This caused more worry. So really we kind of see a cycle here with what seems like OCD, kind of building and building as she tries to continue to put an increasing number of safeguards on her property. Eventually her father got frustrated with this and he took the lockbox, he didn't know the combination to it, he took the lockbox with the photographs in it and just threw it in the trash. He was just done with it, and all the pieces of paper and all the worrying, he thought that would help Brenda cope, but of course this backfired. After this event, when he threw the box away, Brenda characterized her father as a monster and never changed from that position, even through all the therapy. And eventually she felt that all men were monsters, mostly because they did not respect property and did not respect her property. This is what she believed. A few years later, she would adopt the opinion that all women were also monsters because they tolerated men. So really, at some point, everybody was a monster to Brenda because people didn't respect the property they owned, and again, they did not honor the integrity of her property. They touched her property, they damaged it, they borrowed it without permission, so people were problematic for Brenda. During her high school years, she had many opportunities to date, but again, she was not a big fan of people, male or female. She also had a lot of anxiety about dating. She did go on a few dates and generally did show an interest in having a romantic partner, specifically a man, but she didn't really find anybody she liked. She described that there was one date where a young man showed up in a car, but in the car he had uneaten food on the floor and food wrappers all over the floor and the seats. She went on the date anyway, but ignored the young man from that point on. That was really the last significant date that she reports in her history. Brenda went to college. She mostly stayed to herself. She studied some sort of financial subject matter. I'm thinking it was perhaps something like accounting. In her first job after college, she worked at a company in like a financially related department, perhaps something like payables. She detected that money was missing, and her actions led to the arrest of a person who worked in the same department. She was promoted to his job. Brenda was a highly efficient worker that did not miss details. In terms of like accounting for money, she had everything reconciled perfectly every day. She knew where all the money was at any given time. One of her bosses that eventually left the company would ask her to come with him to a new company, which she did. And he put her in a position of responsibility that related to finance, and she was to report only to him. He told her that he thought she was an excellent employee, but it was better if she minimized the amount of contact she had with other people due to the fact that she tended to be highly critical of others. So this is actually something we see a lot with OCPD, where somebody's highly productive, so companies don't want to give them up, but they try to isolate them from interactions because they don't want to lose other employees because of negative interactions with that person. Now, when she entered into counseling with Susan, she still had the same job, but that boss that liked her retired, and the new boss wanted her to try to get along with the coworkers a little better. He also was impressed with her performance, but he thought it would just be helpful to her to be a little bit more well-rounded. Brenda believed her coworkers were distracted by emotions, that they were unproductive, and that they spent too much time talking. Evidently, her coworkers referred to her as the Terminator, and I gather it was from the 1984 version, the original movie. Susan, the clinician, the counselor, asked Brenda if she knew who the Terminator was. Brenda had never seen any of the Terminator movies, but she had assumed that it wasn't a compliment. In a sense, she actually seemed to like being referred to as a robotic killer from the future. She thought that actually matched her personality relatively well. In terms of the OCD-related complaints, Brenda still had counting rituals, and many involved locks and security. Locks to her office at work, her car door lock to her home, and even to her computer. She was resetting the password on her computer numerous times a day, and writing the password down and hiding those pieces of paper in her office. So this is something that we saw before with the code to that lockbox. Whenever she would send documents to her coworkers, she would protect the document and lock it with the password. The reason she sent out the documents locked was that so only she could make changes to them, even if the document was supposed to be worked on collaboratively. She didn't really get along well with the coworkers. She didn't work on projects with them very efficiently. She was much more efficient alone. Even with the OCD symptoms, she was still highly productive at work, arguably the most productive in the entire company. She never took vacations, rarely called out sick, and always followed the rules and policies. Brenda believed that her personality was well suited to her work, but she did not like the OCD symptoms. So there was some lack of insight in terms of the OCPD in a way, but insight in terms of the OCD. So Susan diagnosed Brenda with the two disorders. Brenda really only agreed with the OCD diagnosis. Again, she thought her personality was well suited, but she did not think her personality matched the symptom criteria for OCPD. Interestingly, she didn't think that any of the symptoms for OCPD matched what she was doing. Even ones around perfectionism and rigidly adhering to rules, none of them. She thought none of them really described her. But again, she thought she was well suited. So it's interesting. I wonder really how that assessment went and how that worked out. We see that Susan treated Brenda for 3 years with no success, trying to find ways to satisfy the obsessions. So essentially, Susan was trying to get Brenda to alter the compulsions in some way. For example, she tried to convince Brenda to lower the number of times she counted something from whatever it was, say 10, to something much lower, like 3. So checking a door lock 3 times instead of 10 times. Susan also tried to help Brenda see things from the perspective of her coworkers. Susan's treatment for the OCD was unsuccessful, but she did seem to improve Brenda's relationships with the coworkers. Susan eventually switched to some type of cognitive behavior therapy, perhaps REBT or CT, it's not clear, and started having Brenda challenge the irrational obsessions, the irrational thoughts. So challenging the irrational thoughts and replacing those thoughts with a rational thought. Another way we could put this in terms of cognitive therapy, for example, would be challenging the automatic thought and replacing that with an adaptive response. This seemed to work well in terms of reducing the compulsions, but the obsessions were still there. However, eventually the obsessions decreased somewhat as well. Brenda reported still having some, but she was able, sometimes at least, to dismiss them as being illogical. So overall, there was an improvement that Brenda was happy with, again, by the time we reached the end of the therapy, but not in the first 3 years. Some interesting points from the 4 years of treatment. Brenda always stayed in the session the exact number of minutes that the session was supposed to last. So, for example, a lot of sessions are 53 minutes. They have to be at least 53 minutes. So she would stay exactly 53 minutes. If Susan ended one session early on one particular week, Brenda would add those minutes onto the next session, exactly the number of minutes that were taken off the first session. Brenda had to have the first appointment of the day because the office was cleaned at night and she wanted it to be clean when she got there, and she needed the trash to be empty. Susan couldn't even use the trash can during the session. An interesting anecdote from the time that Susan was treating Brenda. One time Susan was walking into the office. I imagine it was some sort of private practice setting or something like that. And of course, we see that Brenda arrived before Susan to the first session of the day. So Susan walked by Brenda's car and noticed the car was damaged. The bumper was cracked and the taillight was broken. So she asked Brenda what happened. Somebody evidently had hit Brenda's car when it was parked somewhere else. And she didn't really think much more of it. The next week, when Susan arrived for the appointment, she walked by the car again, and all the damage was gone. Right? The car also looked remarkably clean. So she went in and asked Brenda about it in that session, and Brenda had purchased a whole new car. She'd replaced the car that was damaged with an entirely new car. It must have been the same body style, but of course it would have been new, so if the car was a couple of years old, it would be a couple of years newer. They don't really say what year we're talking about. But either way, that's pretty remarkable to have that damage, which could have been fixed, and replace the entire car with a car of the same make, model, and color. Now, the termination of the therapy between Susan and Brenda was a bit unusual. Usually when you have clients for a long time, like 4 years, the termination phase lasts several sessions. Like it takes a few sessions to process all that material and kind of break apart that relationship. So people are understandably emotional. Often the client, of course, but sometimes even the clinician will become emotional with that. So as we move toward the last session, or what Susan thought would be the last session, Susan said, our time is coming to an end, our time together, and because we've been in therapy for so long, it would be nice to use the next several sessions to wrap up any feelings, to kind of wrap up unresolved business. Brenda never returned for therapy after that session. During the time she was with Susan, she only missed 2 times. She was sick. She called out for both times. So that was 2 times in 4 years, which is fairly remarkable considering all the things that happen to individuals, right? Life gets in the way a lot of times. Transportation problems, work, of course getting sick, which I mentioned happened twice, but a lot of other factors. So to only miss twice in 4 years, again, is almost unheard of when talking about mental health counseling. In terms of diagnosing, I can only really speculate, of course, because this was a presentation that I saw. I never saw this client. I would say OCD and OCPD seem to be correct. Maybe some sort of anxiety disorder should have been considered as well. And I would have been on the lookout for depression. The switch to CBT took a long time, 3 years. I can see going 3 months or even 6 months with not much progress, although I'd still like to see some. But 3 years is way too long. Really, CBT should have been used right away, I think, in this instance. Also, Susan found this to be a challenging case. I can understand that challenge. Which do you treat first in terms of the disorders? The client said OCPD, but really didn't take ownership of the personality disorder. So you want to honor what the client says, but you also want to understand they may have a lack of insight. So this became, I think, somewhat challenging for Susan, and maybe this is what caused some confusion and the delay, or maybe she thought that after 3 years something would happen. I don't know, again, why she went so long before trying something different. Again, I have seen clinicians try a lot of different time periods, a few months, even a year. Sometimes it does take a while, especially with personality disorders, and you can't just rush and hope for immediate improvement as a clinician. But this case probably could have been handled a little bit better on the front end. Now, overall, there were results that were positive, which is good, but Brenda kind of leaving after that session where she was told that they really should have more sessions tells me that there was still something unresolved there. And of course, it's clear that the OCPD symptoms were not totally abated, and the OCD symptoms were still present a little bit. Still, with those 2 disorders, that is fairly good progress. Just took a little bit longer than we would normally like to have happen. So a really interesting case, and one that involves a childhood and childhood experiences that are congruent to what we see in the session for both the OCD and the OCPD, and one that really highlights some of the strengths of OCPD, especially the productivity at work. So I know whenever I talk about cases like this, there'll be a variety of opinions, people that agree with me, disagree with me, or maybe have some other thoughts about this particular example. Please put those opinions and thoughts in the comments section. They always generate a really interesting dialogue. As always, I hope you found this presentation analysis of OCD and OCPD to be interesting. Thanks for watching.